13, we're getting close to the final collection of presentations by the Institute for Healthcare Improvement. This is a national curriculum that has been sponsored by AHRQ. And today we've actually added an additional video from the Institute for Healthcare Improvement on more up-to-date on post-vaccination considerations with staff. Okay, so today we want to look at the CNAs during the pandemic. And we know that they give compassion, care, and love to the residents. And they deal with a variety of issues here that are really pretty, pretty heavy lifts. The issue of confusion when people move from one spot to the other. Of course, all the PPE use, the masks, and now that we're having guidance that we can start removing masks with social visits in fully vaccinated visitors and residents. That's good, unless there's an outbreak in the facility. And other topics that are really important in terms of the social welfare of the older adult, including communication with family members about changes in status of the older adult resident. Next slide, please. So it's really been a challenge here to keep a positive mindset. I think surveys are showing that we're up to 30, in some cases 50% of reduced mood, lower mood as a result of the pandemic and a lot of the quarantine that's going on, and just the constant barrage of keeping our guard up, right? There's a lot of fatigue. I mean, we're hearing this repeatedly. And I've got to share with you, I just gave a presentation to our second year medical students at University of North Dakota. And at the end of the lecture, it was on global health. And we were talking, of course, about the ramifications of the pandemic globally and how that's impacted older adults. I mean, I was reminding them that for those even medical students that had not gotten vaccinated yet, that their grandparents have a 20% risk of death from COVID if they get infected. So we have to keep reminding ourselves that there is light at the end of the tunnel, but nonetheless the consequences to our older adult population are just enormous, right? And so it's just important to keep reminding ourselves of that. And they themselves were looking and reflecting on themselves and asking when we were going to return back to regular lectures, face-to-face lectures. And I basically, from University of North Dakota's perspective, probably the fall will be the time that we get and normalize back to face-to-face presentations. That's what they're anticipating, anyways, going forward. So. The whole point of mindfulness and keeping a positive mindset is to make sure that there's a support system. We've said in the past that they're establishing a buddy system, particularly for new hirees, is so important that they match up with somebody as their go-to person. And then just, random acts of kindness. You can get these buddies to, you can get buddy column A with buddies in column B. And as a facility, you can encourage small items, small givings, acknowledgements, maybe just simple cards, little notes that say how much the staff is appreciated. Okay, next slide, please. So we know the CNAs are the front lines. They're really our eyes and ears, and an aspirational goal for CNAs and all of us are to be what we call expert noticers, right? So they're the, and this is what we're supposed to be doing for quality improvement. As we do our walk rounds, for example, what do we notice? What are we observing? When I did walk rounds as medical director for a nursing home, I was always interested in how the staff brought food to the nurse's station, which, eventually got corrected. That was not a good idea. But it was just the idea. So I noticed that, and we transmitted that in terms of an observation. That was an obvious one. Maybe some observations are a little more subtle, such as individuals that are maybe not moving as quickly. You have to really know and be familiar with the staff, but sometimes they're dragging tail, and that in itself is an observation. So again, expert noticers, and so too the expert notification is important with older adults. And so one of the things that could be a good quality improvement test is to get just a small sampling of your staff and the CNAs to ask them what are the atypical manifestations of COVID in residents, and just see what their knowledge base is for whether confusional state, loss of appetite, falls, whether they cite those as atypical manifestations of COVID, and you'll get a better appreciation as to whether they're expert noticers or not. Next slide, please. So our CNAs need to communicate these slightest changes, right? And this is the real challenge. I mean, is that nasal congestion? Is that COVID now, or is it seasonal allergies? So we need to be mindful of just what I was talking about the atypical manifestations of COVID in people over the age of 65. So loss of appetite could be the first. If somebody just says, "Oh, I'm not hungry today," that's COVID until proven otherwise. Falls have been linked to that. Confusional states. In fact, 33% of all confusional states going to the emergency room in older adults is due to COVID nowadays. A patient who just wants to lie in bed, right? Or they're less attentive. They can't focus. That could be early delirium. As mentioned, nasal congestion. And then also the atypical symptoms of abdominal discomfort, bloating, and pain. These are all symptoms of infection in general, but COVID is obviously what we're worried about mostly. But these all can be associated with other types of infection, including pneumococcal pneumonia, respiratory syncytial virus, and influenza. Next slide, please. It's really important to have a strong relationship with health professionals so that you can enhance communication. And there's our structured methodologies. So team steps is a good start for dealing with CNA understandings, and also the freedom to be able to communicate with physicians and nurses. I generally, as a medical director, would ask the CNAs, I'd have small groups of 3 or 4, and just ask them what's going on, what do they see, and out of that actually came an initiative for anger management. They were talking about a couple of family members who just had some anger management issues, and so we created a community presentation on anger management with our consultant psychologist. So sometimes things come up that you aren't really too aware of, and that's where the CNAs can be just an enormous resource of what's cooking. So good. Next slide, please. So CNAs, I mean, despite their what I call under training, they really bring a huge piece of professionalism to the whole process that we're trying to maintain here. So being respectful of family wishes, being good listeners, providing the dignity that's so important. HIPAA, maintaining confidentiality, and then trying to help guide reasonable expectations. I often tell my medical trainees, students, medical residents, family practice, and so forth, that expectations of families and actually of patients often are disjointed, particularly with things like life expectancy. There was a study quite a few years ago, but they asked the opinion of patients with end-stage heart failure as to how many years of life they thought they had remaining. And they uniformly said 10 to 12 years, when in fact they had less than 3 years of life expectancy absolute. And that people don't often understand the 2 to 3 year period of disability that occurs before death. And so I think a lot of this really requires a gentle explanation as to how loss of functional status is a precursor to end of life, but trying to maintain as high of quality of life towards our final years as possible. And so the CNAs have a huge role in that. Next slide, please. So just by their repetitive engagement, and there's evidence that rather than rotating CNAs through different units, but having them become familiar with the patient or the residents really helps build the trust. They are the conduits for providing comfort, physical, and in many cases, spiritual and emotional support. Next slide, please. And CNAs are, for better or worse, involved in end-of-life matters. Sometimes they're the only ones, certainly during the pandemic, who are with the resident at the time of their passing. And they are the conduit for family support. Next slide, please. So with the pandemic, there's some added challenges. There's more COVID-induced confusion and delirium. It's so important to get advanced directives in place. Should there be a do not hospitalize directive for somebody who acquires an infection that might be futile to treat. There's the higher burden of care with body secretions, loose bowels. The residents may be lethargic and less wanting to be repositioned. They may complain. And again, the reduced mood that comes from social isolation. So our last root cause analysis that we did as a group with our other cohort of nursing homes found that there was about 50% reduced mood and sense of social isolation in their resident population. Next slide, please. So yeah, everybody has a little different response to the mortality rate. I can tell you I've signed more death certificates in the past year than I had my entire 25 professional year career. The post-COVID recovery for some of the residents is sluggish in cases, and they if they come from the hospital and back, if they survive COVID, they likely have additional ADL deficiencies. We have not really done a deep dive with our participants into how the MDS has changed pre and post COVID, but that in itself may be telling. And just to mention that in some studies, up to a quarter of individuals post-infection, both young and old, have prolonged symptoms that are stretched 2 months and longer after the diagnosis. And it turns out that vaccinations might be one of the intervention for remediating the post-COVID syndrome. So we're going to stay tuned to that and see how that works. Next slide, please. So there, pros and cons for involving CNAs as quality improvement champions. Certainly the pro part of it is that favorable is that they are at the forefront of resident care. They're part of the team. It does lead to increased job satisfaction if somebody's engaged in quality improvement. It's a potential source of promotion. So actually that would be an interesting question for our participants as to whether they have a policy in HR for CNA promotion based upon engagement in quality improvement. The backside of this is that CNAs don't get a lot of training in quality improvement. We're hoping that this program here and its movement into session 2 will help engage training for CNAs. The big thing is the lack of time. And so unless a facility sets aside time for the CNA to pursue quality improvement, it's likely not going to happen. And then finally, that last point is that sometimes there's a little bit of jealousy that occurs when, why did that person, why did that CNA get assigned, like they're looking over me, and there's a lot of suspicion. So you just have to be mindful of that attitude, and basically try to get everybody participating, and everybody will have their turn. It's not like musical chairs where people get knocked out, with each round. This is something that we want to engage everybody in, and everybody should have a share of the process. Next slide, please. Yeah, so the lack of curriculum is a big deal, where there's some professional organizations, long-term care organizations, that are creating curriculum training for CNAs, and we're looking forward to those rollouts. Of course, these presentations, so we've recorded these, we have the whole series of 16 presentations that can help the CNAs, and so they're you can refer them to this series and engage them in education through our recorded sessions that you can get and download from the Dakota Geriatrics website. Next slide, please. So what we look for optimal quality improvement champions are individuals who want to be educated, looking for personal improvement. It should always be a stretch for somebody, to get better at something. Folks that are facile with relationships, good communication, accepting a mentorship role so that as they get trained, train the trainer. So as one CNA gets trained in quality improvement, then they train another one, and so forth. And then finally, as I mentioned, that they have good communication skills. And some of these communication skills can be structured, right? So we've talked about structured walk-arounds where we have specific questions that we can ask the staff of what they observed, and add to that a commentary is that we don't want anybody to get punished. We don't want to cause any trouble. We just want to identify where there may be areas of concern where we can improve our care. Next slide, please. So the research is not a lot, quite honestly, in terms of CNA's impact on quality improvement. The Canadian study here recently introduced CNAs as QAPI leaders, and the metrics that they were looking at, such as fall reduction, and other metrics were vastly improved once they initiated this program. And importantly, from the nursing literature, CNAs can become mentors for the facility for implementing change. So I think if you harness the energy of the CNAs and guide them towards quality improvement, there's a lot of return on investment for that. Next slide, please. So one of the issues that came up in this research here in Seattle, Washington, was to firstly gather CNAs and RNs and say, how could we do a better job of our handoffs? And so they actually developed a structured protocol whereby the CNAs reviewed the medical record, read the nurse's notes, and then they had a meeting a one-on-one meeting at the resident bedside to discuss what was the care plan. So that really improved quality outcomes enormously just by simply everybody getting on the same page as to what's going on with the patient. And again, like as you use an example for COVID infection, maybe the CNA could comment about lack of appetite and tell the nurse, breakfast was refused this morning. Well, that might prompt a COVID antigen testing at that point. So that's the kind of communication that you want back and forth. Next slide, please. So empowerment of CNAs and quality improvement. This project in upstate New York used the team steps for a debriefing process. They called it Team Talk, and it was on a transitional care unit. And basically, the work life survey improved greatly amongst the CNAs. So this is kind of like what their knowledge and attitudes were about quality improvement. And this project, by using the STEPS program, vastly improved their understanding of what they were trying to accomplish and their job satisfaction, basically, which by the way is important for retention. Next slide, please. So there's some web-based resources for CNAs. There's really, quite honestly, that there's nothing, there's no dumbing down of these resources. I mean, they're basically there's very similar things that we all engage in. What I find with quality improvement and learning about it is that there's a lot of repetition that needs to go on before it starts sinking in as to how these formats occur. When I first was working with the Institute for Healthcare Improvement a couple of decades ago now, it took me about 3 months before I really appreciated what the goals of quality improvement were, and actually using the tools for affecting change. Next slide, please. So you can train the CNAs, but you can also get a baseline knowledge and ask them to use this. And you can cut and paste this for yourselves. We make the slides available, and you can print this one out and circulate it amongst your CNAs and kind of get a baseline as to what their understanding is for quality improvement. And I'd highly encourage you to do that. Next slide, please. Okay, so that's the end of that first part of the presentation. And the bottom line is to find ways to enhance the engagement of CNAs in the quality improvement process. So with that in mind, I'd like to hand it off now to Kelly and our group, Jean, for the quality improvement segment of this.
Great, thanks, Dr. Jerovich. Just a couple of follow-up comments on the presentation there, and then we're going to watch a short video about QAPI. But in the beginning of the presentation, we talked about emotional PPE.
Kelly,
the emotional PPE, if you reference back to the beginning of this program, we shared a one-pager from IHI, and it had some tips and tricks about how you can assist your staff as the leader, as well as what your staff can do in order to promote that emotional PPE. So I just wanted you to kind of look back and see that. Also, just to reinforce that the CNAs have really taken a new role, and really all of the line staff and all of the staff in nursing homes during this pandemic, because they've really had to put forth more effort to fill in those gaps of family members and loved ones with the decreased visitations and such. So just remember that that's probably been somewhat of a challenging time for them, and how can you be there to support them? And always remember that in order to support the staff, you have to be able to take care of yourself first and foremost. So make sure you reference that emotional PPE form and look how you can take care of yourself too. Another comment I had is whenever you're trying to adjust the culture and promote a positive culture for your staff, when you think about CNAs and line staff participating in quality improvement in general, think about how that is going to give them that sense of pride and whenever they accomplish something. I'll comment a few more. I have a few more comments after the video, how CNAs can benefit and how your facility can benefit for CNAs participating. But just wanted to mention that culture piece. And I'm going to, you can go to the next slide and we'll play the copy video, and then I have a couple of comments after that.
Welcome to QAPI for Certified Nursing Assistants, Making a Difference, presented by Health Insight Oregon. What is QAPI? During this short presentation, you will learn to define QAPI, your QAPI role, and how QAPI benefits nursing home residents and staff. But first, meet Louie. Louie is one of many nursing home residents cared for by certified nursing assistants just like you. You work hard providing him with quality care in the place he calls home. Louie enjoys bird watching. Watching birds outside when he was younger and from his apartment window as he grew older is what made Louie happy. You've gotten to know Louie and see that watching birds can make him smile. It's important to his quality of life. So every day after lunch, you bring Louie to a window in the lobby. You feel comfortable that Louie is safe doing something he enjoys while you continue working with other residents. You are rightfully proud of providing excellent, person-centered care. But one day, the lobby is suddenly full of activity and noise. Oh no, everything happens so fast and Louie falls. Luckily, Louie is not hurt. A report is written and his doctor and his family are notified. Of course, his family is concerned about the fall and want to know if Louie can safely continue his favorite activity. You are concerned too. What happened? You remember all the activity and noise just before he fell and wonder if it played a part. You report what you noticed to the nurse, and this information is included in the report. The nurse suggests you also report it during QAPI rounds. But wait, what is QAPI? Right now, your nursing home is tracking information about how care is provided and comparing it with national quality standards. That's quality assurance, or QA. But care can be made even better by identifying and carefully acting on areas for improvement. That's performance improvement, or PI. Quality assurance, QA, plus performance improvement, PI, together make QAPI. Nursing home residents are always at the heart of QAPI. Improving their quality of care and quality of life is what QAPI is all about. Your workplace may already have a QAPI plan in place that reflects your organization's mission and values. Staff should follow policies and procedures which support QAPI efforts. What does that mean? How do you support QAPI? You are already supporting QAPI by reporting opportunities to improve care. QAPI just takes that reporting to the next level. Your report about Louie's fall will be compared to other information to decide if this problem needs special attention. In this case, complaints about noise happen frequently. Residents and their families are concerned that noise from staff and televisions affects sleep. Staff is concerned that noise levels can make it hard to concentrate and communicate. Now it appears that noise may have contributed to a fall. Falls increase the risk of injury, both for residents and for staff. So how can QAPI help? Here's how. QAPI uses teamwork to solve problems. A special team is formed to work on the problem you have helped to identify. This is called a Performance Improvement Project, or PIP team. You are part of the team. PIP teams pull together staff from multiple departments and can also include residents and family members. Why is that? That is because QAPI always focuses on the systems that are involved and not on individuals. Systems? What are systems? A system is made up of two or more parts. working toward a common goal. Nursing homes are a kind of system. Different parts or departments work together with the goal of providing resident care. For example, certified nursing assistants and the Department of Nursing Services are one very important part of the nursing home system. Nursing services, in turn, work with other departments or parts of the system, which all come together to provide resident care. But systems can be tricky. You can't always see what's going to happen when parts of the system overlap. To prevent a fall from happening again, it will be important to include all the parts of the system that may be involved. Which departments were involved here? Did you identify nursing services, the maintenance and housekeeping departments, and office staff? Each of these departments is included in this PIP team. During team meetings, everyone listens and everyone learns from each other. In the end, your team agrees. Noise reached a tipping point and contributed to Louie's fall. Now the team brainstorms about the best possible solutions to prevent such problems from happening again. Suggestions include adding noise meters and educating staff about the health effects of noise. Other suggestions include scheduling housekeeping and maintenance during times when residents are not using the lobby and turning television volume down at night. The goal is to decrease complaints about noise throughout the unit where you work. Your team expects that with these changes, complaints about noise will decrease. Your PIP team plans carefully to put the project into action, including who will be involved, what resources are needed, where it will take place, when it will occur, and how it will be monitored. So what happens next? Your role, as always, is to be accountable for your own performance. That means supporting the performance improvement project as it is carried out, and supporting others as changes are made, because change takes time. During this time, some on your team will collect information to learn if your PIP team is meeting its goal. In this case, your team learns that complaints about noise are decreasing. You are proud to report back to your leadership that, thanks to the performance improvement project, Louie can calmly and safely sit and enjoy bird watching in the lobby after lunch. You can be proud that you helped make a difference using QAPI. Let's review. How do you make a difference with QAPI? You make a difference by learning about QAPI and by actively participating in QAPI. First, what have you learned? You have learned that QAPI places residents at the heart of care, looks at systems, not individuals, and involves all staff and residents and family members in problem solving. How do you participate? What is your role as a certified nursing assistant? You participate by reporting concerns that affect resident care and quality of life, by contributing to PIP teams, by supporting QAPI projects and QAPI policies and procedures. But what's the benefit? Why QAPI? The benefit for nursing home residents is decreased risk of injury and error, better quality of care, and better quality of life. The benefit for nursing home staff is also decreased risk of injury and error, increased workplace participation, and increased job satisfaction. You are making a difference. Remember, certified nursing assistants like you provide essential hands-on care where you work. You are in an important position to make a difference with QAPI. QAPI needs your eyes, ears, and voice. Thank you for taking the time to watch this QAPI learning activity today, and thank you for helping to make good care even better.
Great, thank you. Kelly, I just want to jump in here before you get started again. There was a commentary by Craig Christensen, which is really good, and I think essential, to coming to grips with, which is basically not enough staff, not enough time. My quick take on that is absolutely correct observation, with a big but, which is that as we become familiarized with QAPI, we start to incorporate it into our everyday routine. And so there's a lead-in phase for this. And then eventually it becomes kind of second nature. And it doesn't have to be big chunks of time. So just to give you an example, in my own clinical practice, which is busy, I took at the end of the day, I did a chart audit review of 20 charts to see how well we were applying our geriatric assessments program. And I found that, you know, we're pretty good 50% of the time, but we're missing the boat the other 50% of the time. You know, again, I just structure that as part of my at that end of day activities. And it took me, you know, maybe 30 minutes to do that. But it really wielded a lot of information to help motivate my colleagues to improve their geriatric assessment commitment in the clinic. So that would be a small example. And I think also trying to find efficiencies and release time for people to do those kinds of things. You know, they sometimes just need permission that we're going to give you 20 minutes to do this. The other example that I can give is that sometimes data collection can be on the fly. In terms of hand hygiene, we had assigned a housekeeper, you know, in the facility, and I gave her a little 3x5 card, and I said, I just want you to check, you know, column A, proper hand washing, or column B, not. And so she went through it, did not identify who the staff were, is just with each encounter. And, you know, she came up with a compliance rate based upon her pocket 3x5 card. So that's another example where you can do data collection on the fly. So Kelly, sorry, I didn't mean to barge in on here, but.
I had a couple of comments to respond to Craig as well. So I definitely echo what Dr. Jarovich is saying. And then also consider that it's not necessarily that you're going to pull these staff to add more time to their day, but really make sure that they understand how their input benefits the QAPI process. So in the video, for instance, it was about this person reported to the charge nurse when there was a fall. Since they're on the front line with them, their input about why that fall occurred is probably much more valuable than, say, the administrator or DON, because we're not on the floor to see everything that goes into that fall. The other note I would make about that is when they see, you know, we talked about involving family members and trying to get an idea of why that fall occurred. Well, or getting input from them from what their history is. 9 times out of, excuse me, in my experience anyway, 9 times out of 10, the CNAs see the family members more than I did. If they were knocking on my door, it was because there was an issue of some sort. And so when you start dividing some of those duties up to the line staff who are already right there in front of them, having conversations with them already, it takes down the caseload of some of the leadership staff. It doesn't really increase the caseload of, say, your CNA, because your CNA is already having a conversation with the son and daughter because they see them every day when they come in the facility. But at that point, they can say, hey, I'm sure you're aware, you know, dad had a fall, you know, is there anything in his past that you think could have triggered that? And then they pass that information along. If that doesn't happen, then it's the family members that's at your door saying, why did they fall again? What are you doing about it? So on and so forth. But if the CNA can have that conversation with the family member, it really saves time for everybody, because the CNA is not, the family member is not upset with the CNA because dad fell, and the family members aren't coming to leadership questioning, what are you doing about it? Because the CNAs are able to have that conversation. So the way I like to look at it is for CNAs and line staff to truly understand the purpose behind QAPI and performance improvement, so they can intelligibly have that conversation with those family members, and in turn it would save time on everybody's part. So I think that's something to consider as you're trying to get CNAs involved. Also, when you're rounding, Add that to your checklist of questions to ask CNAs. If you've noticed that on the 200 hall that you've had 5 falls in the past week, well, you can do a root cause analysis as you're walking through and rounding and you're asking the staff these questions to see what their take is on it, on why that has increased. And then you've done your root cause analysis. So as Dr. Jarovich said, it's about incorporating quality improvement into your daily routine, not really adding an additional task, but just incorporating it into tasks that you're already completing. I think we had, the other comment I was going to make about that is that whenever you're having huddles or handoff meetings from shift to shift, you can really talk about the progress if you put a performance improvement project in place. So another opportunity to incorporate it into your daily routine. Hey, by the way, we've had falls. We're now going to have this performance improvement project, and we're going to monitor the success because we're testing on 200 hall that we're reducing the noise on 200 hall. So we're going to update you on your daily huddles as to where we're moving within this process. Or even take those few minutes. Hey, if everybody can give me one idea right now during this huddle of why you think falls are happening, then that's your root cause analysis right there. So just a few examples of how I would think it can be incorporated into those daily routine activities. And I believe we have, and one more comment on data entry. So if you're looking at your performance improvement project and you're trying to track on your audit tool on what's been completed and where your progress is and what your improvement is, if you possibly have a receptionist, or if you have maybe someone in the business office, somebody that may have 15 minutes a day to just do the data entry. And it probably wouldn't even take 15 minutes, but I'm just using that as an example. Somebody who's not necessarily on the floor running 90 to nothing, that may be an opportunity to utilize more resources. And you'll hear me say that from time to time, is try to utilize as many of your resources that you already have in place to kind of not overwhelm one person or one group in the facility.